including yourself. All right. As Laura Graham has stated, none of us wants to be reminded that dementia is random, relentless, and frighteningly common. There are many types of dementia, but Alzheimer's disease is the most common, making up 60 to 80% of dementia cases. It can begin with not remembering a conversation, to taking away all of a person's previous family recollections, including not remembering their own children's names. I have worked in geriatrics for the past 13 years. I've worked with all types of dementia, and I am certified through CARES for dementia care with families. Dementia is not simple. No two people act the same with it. They just have common symptoms. First, treating dementia is an ongoing research. Second, there are a few medications that have been developed that may help manage or protect the brain from the symptoms such as anxiety and behavioral issues. Finally, a healthy lifestyle can be a key factor in preventing later health issues and reducing the risk of developing forms of dementia. To start with, the Institute of Neurological Disorders and Strokes has ongoing research to bring hope to those whose loved ones are currently dealing with dementia. Many types of research are being used. Research that is being worked on is to discover biomarkers that can be attained through brain imaging and blood tests. Scientists are also continuing to look at our genes that may be responsible for the development of Alzheimer's and other dementias. Global research is being worked on. The International Alzheimer's Disease Research Portfolio helps individuals learn about research related to both Alzheimer's and related to dementias at public and private organizations worldwide. This helps organizations leverage resources and avoid duplication of efforts. So global research is an ongoing effort to discover genes that are responsible for the development of dementia. Furthermore, dementia cannot be cured, so medications have been developed to reduce the symptoms and the progression of the disease. So there are several types of medications that help with anxiety and behavioral issue. Anti-anxiety medications are used, such as Wellbutrin, Lexapro, Zoloft. These help with anxiety. These also help with obsessive compulsive disorder and with sundowners. Sundowners is a neurological phenomenon associated with increased confusion and restlessness in people with dementia. Behavioral medication such as Risperidone, an antipsychotic, can also be used. That works on mental and mood disorders by calming agitation through its sedating effects. So the purpose of the medications is to keep the patient in a more relaxed state so that the sundowning hits. When the sundowning hits, the caregiver has less aggressive behavior to deal with, because people with sundowners can become very, very aggressive. Most importantly, a healthy lifestyle is essential for prevention. So a clean diet is a very important preventative care. Most studies suggest that regularly drinking large amounts of alcohol increase the risk of dementia. So alcohol consumption contributes to dementia. Poorly controlled diabetes is a risk factor for stroke and cardiovascular disease. It also can increase your risk for vascular dementia. So we would want to avoid doing these. Exercise is another important form of prevention. Physical activity can benefit mental well-being, and it can also improve daily functioning and the quality of life in people with dementia. So we know it will help before dementia even starts. Researchers are assessing the combined approach of aerobic and cognitive exercise to see if it can delay or slow the progression of Alzheimer's disease and the risk for older adults. In conclusion, we have learned that dementia is not a simple disease. There are multiple forms of dementia, with Alzheimer's making up 60 to 80% of those dementia cases. And there are medications that assist with the symptoms of dementia, but they cannot cure the disease. And having a healthy lifestyle is the best form of prevention. So as Laura Graham stated, none of us wants to be reminded that dementia is random, relentless, and frighteningly common, but unfortunately it is. May our global efforts help to bring help to those whose loved ones are enduring this disease. Let's remember what Benjamin Franklin said: an ounce of prevention is worth a pound of cure. Thank you.